Another question you might have is, what will the doctors do to make my mom or dad better? There are several different ways to make cancer go away or get smaller, and we call those ways treatments. There are 3 types of treatments for cancer. They are called chemotherapy, radiation, and surgery. Your mom or dad may be getting one or all of these kinds of treatments.
Everyone's cancer can be a little bit different from someone else's. So when your mom or dad meets with their doctor, the doctor decides, depending on what type of cancer they have and where it is in their body, which treatment to give them. Not everybody gets chemotherapy, radiation, and surgery. Some people do get all 3. Some people may only get 1. Some may get 2. Some may get none if they don't need any.
Let's talk about chemotherapy. Some people call it chemo for short. Chemo is a special medicine that is put into the body to attack cancer cells.
Chemotherapy can be given 2 ways. It can be given as a liquid medicine that goes into your veins through a needle. So sometimes when someone is in the hospital, you'll see they have a bag that's hanging by their bed with a tube that is connected to a needle that goes inside their body. Sometimes that needle goes in their arm, sometimes it goes in their chest. It can go different places. Chemotherapy can also be taken as a pill, just like a regular vitamin that anybody would take.
Cancer cells are fast-growing cells. Once chemotherapy is in the body, it looks for and attacks all fast-growing cells.
Cancer is kind of like crazy cells in our body. They're very fast-growing cells. They're bad fast-growing cells.
The problem is that not all of the fast-growing cells in our body are bad cancer cells. Some of our good cells are fast-growing too, like the cells in our hair, nails, lining of our mouth, and belly.
Let's say chemotherapy is like a monster, and in order to get to the bad cancer cells and attack those cells and get rid of them, along the way it's going to run into some good fast-growing cells.
The problem with chemotherapy, it's not a smart medicine. It doesn't look at a cell and say, are you a good cell or a bad cell? It just says, you're moving quickly, we're going to knock you over.
Some other good fast-growing cells that are affected by chemotherapy are found in your blood, like red blood cells, which carry oxygen from the air that you breathe to every cell in your body, white blood cells, which eat bad germs that can make you sick, and platelets, which clump together to form a scab when you bleed.
So those are the important parts of the body that may also be made sick by these medicines that we use. But if we don't use the medicines, we can't stop the cancer.
When chemo destroys some of those good cells, your parent might experience some side effects. Side effects are things that happen to your mom or dad during treatment that may make them feel or look different.
The things that are first noticeable for somebody getting chemotherapy and other treatments for cancer usually is when their hair falls out. It starts about 3 weeks or so after they start their chemotherapy treatments, and at first it's just a little bit, and then it's a little bit more, and then all of a sudden their hair is pretty much going out in big handfuls and clumps, and they wind up with no hair. And if that's your mom or dad, and you've always known them with hair, it's kind of shocking the first time you see your mom or dad bald.
My mom has breast cancer. My mom has gotten chemotherapy. She has gotten radiation. The first question I asked was, why is your hair falling out? Because I had noticed that there was hair at the bottom of the shower. It was just a little strange seeing her bald. It made me uncomfortable a little bit.
Sometimes you might notice that people feel tired, and sometimes the chemotherapy makes them sick to their stomachs. They might throw up. We have some medicines that help a lot with that, but they're not perfect, and that can be really upsetting to see. The other thing that happens is that all of their blood is a little thinned out, so they might need somebody else's blood given to them.
A few other things you might notice are that your parents' fingernails might fall out, or sometimes they can get sores in their mouth. The good news is that most of these side effects are temporary. So once your parent stops getting chemotherapy, these changes should go away. Also, it is important to remember that even though your mom or dad may look different or act different, they're still the same person on the inside.
The whole goal for taking care of somebody with cancer is to get all the cancer cells out of their body. You don't want any living cancer cells left behind in their body, and if they have a solid tumor, a big lump somewhere or maybe a bunch of lumps, one of the best ways to do that is to do a surgery. What that means is a doctor who specializes in cutting things will bring the cancer patient into an operating room.
After the doctor puts your mom or dad to sleep, he or she makes a cut and goes into the body to take the cancer out and also to see if there's any more cancer left there. With some kinds of surgery, people are in the hospital for weeks, and with other kinds, they go home on the same day. It just depends on what kind of cancer they have and where it is in the body. Now, let's talk about another kind of treatment called radiation therapy. Radiation is a special kind of energy beam that comes out of a gigantic machine that is aimed right at the cancer in order to shrink it or get rid of it completely.
Radiation is really kind of like light with a different amount of energy in it. A lot of energy. Think of your microwave turned on high for a long time, that amount of energy. And the idea is that you point the radiation where the tumor is, and it sort of fries it. And if you fry it enough, then it goes away.
Some people wonder if it hurts because the machines are so big. Sometimes it looks like the radiation hurts. Generally, the radiation doesn't hurt. If it does, it might feel just like a little bit of a sunburn. But overall, it doesn't hurt like it looks like it would.